A leading medical organisation's now called for the immediate recall of Parliament to discuss the crisis. Dr. Matt Kneale joins me now, co-chair of the Doctors Association UK. He's also a junior doctor in Manchester. Dr. Kneale, good morning.
Good morning, thanks for having me.
Good to have you on the line. Now, we're all used to seeing, sadly, aren't we, some pretty appalling images of crowded A&E corridors packed with patients on trolleys and the like for hours on end, queuing ambulances outside across the Christmas period. Just tell us, firstly, what's the situation been like in your own hospital over Christmas and New Year?
Yeah, you're quite right. I think it's been well publicised, some of the major issues in terms of people queuing and waiting for 12 hours, people in back of ambulances for hours on end, which is just, frankly, unsafe. But on a personal level, it gets even worse than that. We've had really harrowing stories from doctors all around the country telling us people have been having intimate examinations in the middle of corridors. They've been on oxygen, but insufficient levels because they're running out in hospitals locally. And these things are just, they would be never events, many years ago, prior to COVID, prior to austerity. This is all basically driven by a lack of funding and a lack of staffing. The reason we've called for a recall of Parliament is this is a crisis, really. The system is broken. It's completely collapsed. People say, is it collapsing? I think it's too late for that. It's already gone. When you look at the day-long waits in A&E hospital beds, you look at people dying in the back of ambulances. Is it any wonder that staff are really burning out to record levels and leaving the NHS? It's just not good enough. We need to focus really on getting staff retention, increasing pay, increasing the level of funding. I know that Keir Starmer said there can't be any big government check, but there needs to be increased funding to meet the ageing population.
Just where you are, how have you managed, certainly in recent days, alongside those overstretched colleagues? How short-staffed are you where you are? And also, what are the main illnesses and ailments, actually, that people have been coming into A&E with?
People come to A&E, it hasn't really changed. They come in with pneumonias, they come in with heart failures, with kidney injuries, those sort of things. They come in with trauma, obviously, when they're involved in accidents. Those sort of things never change. The political pressures don't affect that. I'm currently based, actually, in GP at the moment, and the workload there is really overwhelming. We're seeing huge volumes of patients coming in and unable to, unfortunately, get appointments all the time. Really, they're the sort of pressures on a day-to-day basis.
We heard you, just getting back to Rishi Sunak's big keynote address of yesterday, he did admit, didn't he, that something has to change, as he promised to cut waiting lists for patients, but he didn't exactly confirm when it would all happen. So how did you and your colleagues on the front line sort of react to that rather vague statement?
No, his 5-point plan is just desperately short of detail. It sounds like another soundbite, really, and unfortunately the track record from the last few consecutive Conservative governments has been really, really poor. We've not had any investment, and we've known the issues for a long time. We've known about the issues of staff retention. We've known about inadequate pay. We've known about inadequate funding. And some of these issues have preceded COVID. Yes, it's definitely exacerbated things. I'm not denying that. But the issues have been known for much longer and haven't been dealt with. It's arguably a deliberate decision to underfund.
Do you know yourself, say, junior doctors in whatever field just now who have quit already? They're just fed up with the sheer level of pressures and workload?
Oh, yeah, many. I don't even know how to put a number on it, but so many of my colleagues are either leaving the NHS and going to Australia, New Zealand, where the pay is better and the quality of basically working life there is better. So that's one thing. Some people are leaving altogether, not working in healthcare. They feel so burnt out. Arguably, levels of kind of PTSD and things really from working in the NHS for the last few years. They've decided to sack it in altogether.
Give us a sense of what you guys earn.
So, that really varies. So when you first start as a junior doctor working, and that term is really quite annoying, actually, a junior doctor. It could be anyone who's straight out of medical school up to basically just before they become a consultant, 7-8 years down the line. But when you first start working in the NHS as a junior doctor, you'd make around £28,000 a year here or there. It varies a little bit depending on the placement you're on and the hours that you do, but that's the rough ballpark.
Gosh, it's not much, is it? Given
it's
the
not
cost
much to deal with all these things, also the pressures and the
Yeah, I mean, cost of living pressures and all that as well. So when Rishi Sunak, he urges hospitals not to cancel elective surgeries despite the severe pressure, as you have so graphically outlined to us, on all of our A&E departments, by the sounds of it, up and down the country. I mean, that's a pretty big ask, isn't it? I mean, something's got to give.
Yeah, and I think it's really unfair, actually, to put this pressure on patients, really. People who are waiting for operations and things like that, it's affecting their quality of life, isn't it? You look at people who need knee replacements desperately for arthritis, those sort of things. These patients are really in a lot of pain. They need operations doing. It's not fair to say, you have to wait another year for your surgery. It's really unfair to put that pressure on patients. The public need to be served by the government. They need to be adequately funded in having these things done.
Dr. Matt Kneale, appreciate your time this morning. I know you've got a busy day ahead. Thank you for joining us here on LBC News Breakfast.